I'd like to distinguish between a grilling versus a conversation during a new patient interview. I've seen many variations of the new patient interview. Some practices completely delegate the new patient interview to team members. This approach is usually combined with lengthy medical and dental history questionnaire forms. Treatment coordinators will review the questionnaire forms with patients along with discovering patients' chief complaints. Other practices bring new patients into the practice through the hygiene schedule, where a hygienist will review medical and dental histories and provide a cleaning appointment. There are other variations of providing the delegated new patient interview. What they all have in common is they can take a form of a grilling. A grilling is an interrogation, asking probing questions like, how often do you floss? And when was the last time you visited a dentist? And do you want to keep your teeth? Although these answers to these questions can reveal patients' mindsets about their dental health, the processes of discovering the answers can feel accusatory to patients. The grilling approach to medical history review can feel even more critical when answers to sensitive medical history questions are revealed. I understand that questions related to medical and dental histories require direct answers. However, a far more gracious way of conducting the new patient interview is to provide it in the form of a conversation, not a grilling. You see, the word interview comes from the French. It means to see each other. Consequently, a successful interview results in patients learning something about us, the interviewer, and our learning about the patient. You see, it's a two-way conversation, whereas a grilling is one-way information gathering. The optimal process for an interview is one that the dentist conducts before any clinical procedures. Here's why. Dentistry, especially complex dentistry, is personal to patients. They want it to be personal to us too. Keep in mind that the objective of the new patient interview is twofold. The first is to learn about the essential medical and dental history issues. Next, the new patient interview is about initiating a good relationship with patients. It's been my experience that a dentist-led new patient interview before any clinical procedures is the best way to initiate good relationships and ultimately establish trust in dentists and their recommendations. An essential aspect of the new patient interview is patients learning something personal about the dentist. This is especially important for complex care patients. Many dentists feel it's inappropriate to reveal bits of their personal life. I take the opposite point of view. Give patients a sense of who you are other than your role as dentist. Good conversation technique starts with being authentically curious about your patient's life roles other than that of being a patient. Ask about their family or their work or fun stuff they do. Then volunteer a bit about your family and hobbies or fun stuff that you do. Remember that the new patient and treatment acceptance process is a form of leadership. If you intend to lead, patients need to know whom they're following. A good interview technique is one in which each party to the interview learns something about the other that establishes a connection. It's connection, not information, that builds confidence and trust in patients. When it becomes critical that your practice better fulfills its vision of providing excellent new patient experiences and improved treatment acceptance, my work becomes the perfect companion to fulfill that vision. When you're ready to discover more, consider visiting Treatment Acceptance Mastery. Thanks for listening.